We have a bill before us. Representative Shoemaker, if you could mosey on up. You got a long distance there, Representative Shoemaker.
Make some shoes. Showmaker. How about showmaker?
And I suspect you'll move your own bill and tell us about it.
Thank you, Mr. Chair. Yes, I would like to move House File 1925 be referred to the General Register.
Actually, we're going, oh, never mind, forgive me. Okay, go ahead, tell us about your bill.
At least as it stands now.
Yep, yes, you're right. You are correct, Chair. Chair Schumacher, I should be more formal.
Yes, before amendment here, File 1925 is the Nurse Licensure Compact. This would allow us to join 43 other states that are also part of this particular compact and align with the 7 other compacts that the state of Minnesota entered into over the last couple of years. Just as a side note, we have 29 interstate compacts that we participate in Minnesota, 10 of which are in healthcare. The idea here is to have better care coordination, especially with telehealth and in person. For those of us who represent border communities, it's very important that we have as much coordination in those pieces as we can. There are restrictions and guardrails onto what we have here. Anyone who participates in the Nurse Licensure Compact must pass the same National Council of Licensure examination. And there is a federal criminal background check that is also required here. Essentially, we want nurses to be able to practice to the full extent of their license within this compact here. And I've talked about this bill, I've had this bill a number of times throughout the years, and really thinking today may be the day. But if it's not, the reason that we do this is because of the, especially for me, the border community piece of it and the challenges that come with that. Previously, when this bill has been up, it's been more about the impact on the system, the hospital systems themselves, and coordinating the care piece of it. But over the last couple of years, as in our community, we've developed more nurse training in high school settings and having them come to our old hospital system in Laverne and train. They train in Minnesota while they're in high school, and then they go to Sioux Falls to finish out their licensure training because of the Nurse Licensure Compact. I'm surprised there are not a lot of issues that we talk about in this committee that people recognize generally, but this one is one of those issues that nurses in particular talk to me about and that I hear a lot about, and I see the drain of my own constituents who we were good enough to raise them through high school, but then they go to South Dakota and we don't see them again for that. And so that is why I am bringing this forward once again and hope to make it work this time. Thank you, Mr. Chair.
Thank you, Chair Schumacher. I have an amendment labeled A1. Chair Schumacher, would you like to move your amendment?
Thank you, Mr. Chair. Yes, I will move the A1 amendment. The Nurse Licensure Compact Bill overall is part of, and the reason that we have this in front of us today is it's a recommendation from the Rural Health Transformation Program. The amendment here is also a recommendation from the Rural Health Transformation Program. It allocates 2 hours of each continuing education program to go for physicians, physician assistants, and advanced practice registered nurses to focus on nutrition. And with that, I'd ask for your support.
Okay. Any further
Question?
Go ahead, Chair Bierman.
Thank you, Mr. Chair. Thank you, Representative Schumacher. Question on the A1. Would this nutrition education be something coming from a reputable source? I noticed that the food pyramid's been flipped, and I'm just concerned about some of the guidelines coming out right now with HHS, and I have just a question of if you know the guidelines already for this.
Chair Schumacher.
Thank you, Mr. Chair, and thank you, Mr. Chair. I don't know exactly what the standards are for the continuing education credits. I just know that this would require that 2 of them be nutrition-based within that. And so whatever systems are being used now, this would just be options that, or they'd be less electives and more requirements for that.
Yeah, I think that, Mr. Chair.
Yeah, Chair, go ahead,
sorry.
Chair. No, that's okay. Go ahead,
First
Chair.
day.
Yeah, it is.
I think
Learning to drive
more
again.
education about nutrition is important for all of us, so I don't necessarily disagree with this amendment, but I think anything we're voting on that would go into law, we should know ahead of time what that would be. That would be a prudent step to take, even if we put it on contingently.
Okay. Representative Hewitt?
Thank you, Mr. Chair, and I'll go quick, Chair Schumacher. My concern with this is being a person that has to continuously do CEUs and having the people that sit at this table decide which CEUs they should do. It's more of government overreach again. I think the medical practice boards and the nursing board could very much tell what's actively going on in the community right now and what they have to look at. We all have had these discussions with people that come in our office about, oh, the EMTs have to learn this, the nurses have to use this. When are we going to draw a line to this? This is really, I think this is cantankerous. So thank you, Mr. Chair, and thank you, Chair Schumacher.
Chair Schumacher.
Oh, no.
Did you have any questions? Okay. Then we have Representative Ryer, Vice Chair Ryer.
Thank you, Mr. Chair. Thank you, Chair Schumacher. My question is, this is really broad. Does this apply to all physicians, PAs, nurses, APRNs rather, regardless of the nature of their practice?
Representative, Chair Schumacher.
Thank you, Mr. Chair and Representative Breyer. That is my understanding, yes.
Any follow-up?
Thank you, Mr. Chair. So I'm picturing someone going in for surgery, say, and as the surgeon is saying, we're going to do thus and such, they need to have, this is a good use of their ongoing training. How does that fit with their actual practice?
Chair Schumacher.
Thank you, Mr. Chair and Representative. That is a fair question. I don't have a good answer for you on that and how that directly applies, not being a physician myself or having to make determinations on what I'm going to do continuing education on for that. So that's the best I can give you.
Ms. Chair Liebling, you're on the list.
Yeah, thank you, Mr. Chair. And my question kind of went the same direction. I'm just really puzzled, like a forensic pathologist would have to get 2 hours of nutrition. Or my daughter-in-law, who is a PA who does derm, you know, if you're going to say that, because 2 hours of one thing displaces 2 hours of something else that may be actually relevant to them. So I don't understand why we're dealing with this. And maybe my question for you, Chair Schumacher, is like, you mentioned that this was part of the rural health transformation. Could you explain a little bit, like, why is this being brought? I really don't understand what the purpose is. This really runs contrary to the way we've done this. We don't sit here at the table and decide what kind of education different practitioners should have.
Mr. Chair Schumacher.
Thank you, Mr. Chair and Representative Liebling. Yes, so when I was talking about this was a recommendation as part of the Rural Health Transformation Program. Future monies that get allocated to the state are going to be based on those recommendations that they have, this being one of those programs. The other amendment that we talk about, another one of those programs. And so the thought is here, by passing these, we would be eligible for more funds from that program in the future. That's where it's coming from.
Well, thanks, Mr. Chair. And I guess I just would say then that sounds to me like we're just letting the Trump administration decide for us what we should do here with our practitioners in the state, or do things that we think they might like. Maybe RFK Jr. might like this, and then we'll hope that that'll make them look more favorably on us in the future. I don't know if, I don't want to put that in your mouth, Representative Schumacher, but, you know, that's kind of what it seems like to me, and I certainly would not support this.
Okay. Representative Bauer, And then we have Representative Carroll, and then we'll take a vote.
Thank you, Mr. Chair. And, I guess my question is somewhat similar in that, I'm trying to understand what we're trying to solve with this and what we're trying to do here. I mean, should ortho surgeons and residents be training on nutrition? Should it be, should advanced practice nurses who have considerable amounts of continuing education that they do on a regular basis? It's why we hold Minnesota nurses up to the highest possible standard in the entire country. It's because they have these continuing education that they must do that relates to the specifics of their job and as they do it each and every day. They have very specific specialties. My mom was a cardiac critical care unit nurse. I'm going to be honest with you. I don't know that 2 hours of training on nutrition is at the top of her list, but knowing how to make sure that she can handle cardiac arrhythmias might be, right? If there's new technology or techniques to look at that. I really struggle with that. And moreover, if the whole point of this is so that we can get access to a pot of money from the federal government for doing something that doesn't make any sense, does this not fit exactly into the pot of waste, fraud, and abuse? Isn't this wasteful? I mean, why would we do this? It really literally makes zero sense and is completely wasteful to be asking practitioners who have no relation to nutrition to be taking a class on nutrition. It sounds like wasting money just to waste money. And I don't know about you, but as a taxpayer, I don't really feel like doing that. That would be my, so maybe you have more that you can shed light you can shed on why we're doing this and what we're solving by doing it.
Mr. Chair Schumacher, did you have a comment?
Thank you, Mr. Chair. Just to reiterate the same points that we had before. We have access to a pot of money, and this helps us get more with that, and that's why I brought the amendment forward today.
Okay, and then finally on this amendment, Representative Carroll.
Thank you, Chair. A lot of my concerns have been addressed by these previous questions, but let me just ask, how much is the pot of money we're talking about?
I do not know that answer.
That's to the test.
I'm sorry, I thought you were looking at me.
I was looking at you.
Okay, good.
Addressing the question you to.
I know, I mistook your, Mr. Chair Schumacher, I'm going punt to you.
Thank you, Mr. Chair. Representative Carroll, that amount is undetermined at this point. The federal government, is my understanding, needs to know and see more of what the states are doing with the recommendations that were made in that program before they can determine a full allotment.
Thank you. It sounds like this isn't ready for prime time, and I won't support it.
Okay. With that said, hearing no more discussion, all those in favor say aye. Aye. All those opposed?
No.
I pretty much think this is down partisan lines, so the motion fails. So due to a tie. Okay, I have, what we're going to do is be with time limit, we're going to skip to Amendment A. There represent, if you are not objected, would you, Amendment 3, would you be?
Thank you, Mr. Chair. I would move the A3 amendment. This is just getting to the base bill for the compact, updating the language. Of course, this bill was introduced last year with high hopes that it would be in the 2025 season. This just changes it to the 2026 season for that.
Okay, any further discussion? Okay, hearing none. Those in favor signify by saying aye.
Aye.
Aye. Those opposed? Okay, the motion prevails. We're going to jump into our testifiers.
Mr. Chair, point.
Yep, go ahead, Representative Hewitt.
A2, is this being withdrawn, or what are we doing with this one? Because you weren't clear on what you're doing with it.
Mr. Chair Schumacher, would you?
We can do it quick. I think the conversation
Okay.
is very similar to the.
Yep. Well, if we can do it quick, I want to get to the testifiers. So let's do
Yes.
that. Representative Schumacher moves an amendment labeled A2. Does everybody have a copy of that amendment? Can you tell us about that amendment?
Thank you, Mr. Chair. For the same reasons that the A1 amendment was offered, there was also a recommendation in the Rural Health Transformation Program that would reinstate the presidential fitness test. This would compel schools to participate and offer parents an opportunity to opt out of it. If this were to be adopted, then we would change the initial motion to re-refer this to the Education Policy Committee for further consideration.
Okay, further discussion? Okay, all those in favor say aye. 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 All those opposed?
No.
I think it fails. Motion fails. Okay.
Mr.
With
Chair,
that, yep.
one other thing, at the end of the bill, there is an appropriation, so instead of the general register, I would think it would have to go 2 ways, or state gov if it does
Yeah,
pass today.
Okay.
yeah. And Mr. Chair? Mr.
Yeah.
Chair, along the same line, I think that these compact bills also went to judiciary before because they have legal implications. So I think that if the bill leaves this committee, which I think is a big if, it would have to go also to judiciary, I believe,
Okay.
at some point. So if, I don't know what the next stop would be.
Okay. Okay, very good. Point well taken. Today, we have testifiers, hearing from 6 testifiers on House File 1925. First one is Ms. April Gunhove. What's that? She's on Zoom? Okay. Are we? You got it? But you got it. I don't know how to use it. While we're working on that, we're going to go to the second one. John Porter with the Minnesota Organization of Leaders in Nursing. We do have to, because of time, keep your testimony down to 1.5 minutes, please.
Minute and a half.
Thank you.
All right. Good afternoon, Chair, members. My name is John Porter. I am a registered nurse, a nurse leader here in the state of Minnesota, and also a member of the Minnesota Organization of Leaders in Nursing. I'm here to ask for your support in Minnesota joining the Nurse Licensure Compact. I bring kind of a unique perspective. I was a nurse in Texas and Oklahoma for a number of years before I came up here. I think Minnesota does healthcare exceptionally well. Now, from a nurse leadership perspective, workforce flexibility is not a luxury. It's essential to maintaining safe, uninterrupted patient care. Healthcare systems across the state invest significant time and resources in workforce planning. The Nurse Compact will allow us to provide a modern, regulated mechanism to responsibly bridge gaps. What happens is, despite all of our planning, lots of times multiple factors will happen, multiple variables will occur, such as unexpected absences, leave of absences, vacancies, seasonal gaps, such as a flu shortage. That creates these gaps. The Nurse Compact allows us to bridge these gaps in a safe and responsible manner. And my real point, when I'm really here, is it's not just a short-term bridge. I think that the Nurse Compact Act will allow us to act as a long-term recruitment strategy. I think that when we bring nurses from other states here, they're going to experience the culture, the workforce that's here. This is an amazing place to be, to work, to live, to raise a family. I think they come here, they see how good it is. I think they're going to stay. So I would ask very much for your support to help us support our workforce short and long term.
Thank you. Are we ready with Zoom yet? Okay, next we have Ms. Gayton, RN, and then on deck is Ms. Arnold, RN. And thank you, Mr. Porter. Please state your name and.
My name's Tani Gaitan. I'm a nurse at Alina Health in Owatonna. I was born and raised in Minnesota. I graduated in 28 with my nursing license here. I travel nurse for 4 years throughout Alaska, Iowa, and Wisconsin. I get my license through endorsement. Every state has different requirements for what lets them be a nurse. Every state has different practice laws. So because of that, South Dakota, Montana, Wisconsin, Colorado, none of these states require continuing education for their nurses to renew their license. And the compact Nurses only need to renew their license in the original state that they were licensed, and they're allowed to work in other states. For example, Minnesota nurses would have a huge leg up. We are much greater qualified than other states. Other states, such as states from South Dakota, as you so mentioned, Representative Schumacher, they don't need to continue their education. They don't require any credits. These nurses have a much greater authority of care as well. When I share patient and staffing stories from my travel days to nurses in Minnesota, they consider them unfathomable simply because these types of situations don't occur in Minnesota. Yet, they can quickly and repeatedly if we weaken our standards by passing the compact. I've had nursing supervisors try to tell me to tuck patients in because a seizure patient from the ER when we're already over safe ratios and say the next staff can deal with it. In Iowa, I had up to 8 patients a day on day shift on a post-cardiac floor. 4 to 1 is the highest it should ever be in Minnesota. I've witnessed firsthand so many safety violations. The last thing I will say, in interest of time, is that simply saying having a greater pool of nurses available directly equal to better patient ratios is irresponsible and narrow-minded. We don't receive the same experiences and we don't have the same standards as other states. I think it's important for our patients to remain safe by holding our standards and keeping the compact out. Thank you.
Thank you. Ms. Arnold, and then after that, on deck is Ms. Kempf. So go ahead.
Okay.
Ms.
Good
Arnold.
afternoon, Chair Backer and committee members. My name is Laura Arnold, and I am a Minnesota-trained registered nurse. I've been in Minnesota my entire career. As you all know, Nurse Compact allows nurses to obtain the primary state, their license in primary state of residence, and then practice in other compact states. As the previous testifier said, that does not mean all these nurses are created equal. Their competency can be vastly different. For example, in Minnesota, we are required to do continuing education to stay on top of the latest trends, or changing trends, and latest information in patient care. As my previous testifier said, other states do not require that. If nurses are brought in from other states, the populations that face significant risks of negative impacts are those seeking reproductive care, including abortion care and gender-affirming care. The right to receive these cares were deemed so vital that Minnesota saw fit to legislate these protections for these patients and providers right into our constitutional law. Whereas many compact states explicitly ban gender-affirming care, abortion, and other reproductive care. We know how the employers operate. We know that an out-of-state nurse coming to Minnesota to provide care will face significant training barriers in getting up to speed with Minnesota laws. This could even lead a nurse to inadvertently put their license at risk. I have been a nurse at Children's Minnesota for over 18 years and currently work in the inpatient mental health unit. Throughout my career, I have seen the impact of having access to gender-affirming care has had on the LGBTQ+ population. Many vulnerable patients look to Minnesota for access to reproductive health, abortion, and gender-affirming care. The LGBTQ+ community is particularly vulnerable to decreased access to health care. Finally, I will say it is imperative we are able to advocate and have expert care to save lives, because if you do not know how to care for these people properly, their mental health is at extreme risk. I urge you to oppose House File 1925. Thank you.
Mr. Chair, can you please remind the committee about outbursts, especially during testifiers? Thank you.
Thank you. Ms. Andrea Kempf, thank you. And then after that, we have Ms. Bringley. New Bringley will be on after you. Go ahead, please. Minute and a half, please.
Hi there. Good afternoon, Chair Becker and Co-Chair Bierman and other committee members. My name is Andrea Kempf, and I'm a proud registered nurse and member of the Minnesota Nurses Association, the union representing 80% of nurses that actively work at the bedside in hospitals across our state. Hospital administrators and lobbyists talk extensively about the crisis in the nursing workforce in our state, but they do not actually address the root of the problem, which is that they, the employers, have created work environments that are unsafe for workers and patients and simply unsustainable. These same administrators have also done nothing of substance to address rampant retention issues. In fact, some of the big systems will openly talk about their 25% annual turnover rate, as if nurses are dispensable and that it's just a cost of doing business. Proponents of this bill claim it's a solution, that it will make it easier to bring more nurses into the state. But from data from compact states, does not support this claim. Hospitals and nursing homes in compact states are experiencing the same sorts of workforce issues we are here in Minnesota. This bill is a false solution and a smokescreen to shield the employers from fixing the things that are very much within their control right now. Chronic understaffing puts patients and nurses at risk, and persistent workplace violence that hospital administrators continue to ignore. These are the reasons that nurses continuously cite as to why they are leaving their jobs. If hospital CEOs really want to address the narking workforce issues in our state, they will start listening to nurses and start addressing the issues we have been saying out loud for years as to why our colleagues keep leaving the bedside. Please support nurses, patients, and labor by opposing HF 1925. Thank you for your time, Mr. Chair and committee members.
Thank you, ma'am. Okay, and then we have Ms. New Bringley, and then after that, we have Ms. April Gunhoud. Go ahead, please. Minute and a half. Thank you. Welcome back.
Thank you, Mr. Chair and members. I'm Ann New Brindley, and I represent the Minnesota Business Partnership. The Minnesota Business Partnership strongly supports Minnesota joining the Nurse Licensure Compact. As we all know, Minnesota is a leader in healthcare delivery. Nurses are central to our healthcare system and valued, as is evidenced by the fact that nurses in Minnesota are among the highest paid in the country. While at the same time, Minnesota remains outside of the compact while all of our neighboring states participate. This puts our providers at a disadvantage and limits their ability to respond quickly to staffing needs. The Nurse Licensure Compact, which is functioning in the majority of states at this point, is a proven, well-established framework that allows nurses to practice in multiple states under a single multi-state license while fully preserving Minnesota's authority over scope of practice and discipline. It improves workforce mobility, supports telehealth, and expands access to care without compromising patient safety. I would add, workforce flexibility is especially critical right now as Minnesota implements its new paid family medical leave program. While the Minnesota Business Partnership recognizes the importance of paid leave to employees and families, the new structure is already resulting in longer and more frequent workforce absences that are exacerbated in the healthcare sector. Healthcare employers face a unique challenge. They are responsible both for providing essential care to all Minnesotans and for employing the nurses who are the caregivers that families will turn to as needs arise. From a business and workforce perspective, joining the Nurse Licensure Compact is a low-cost, high-impact policy change that will make it easier to recruit nurses from other compact states and maintain continuity of care during these staffing disruptions. For these reasons, the Minnesota Business Partnership urges policymakers to support Minnesota's entry into the Nurse Licensure Compact to strengthen our healthcare workforce, improve access to care, and ensure that Minnesota remains a leader in healthcare delivery. Thank you, Mr. Chair.
Thank you. And then we're going to go to Zoom. Go ahead.
Good afternoon, Mr. Chair and members of the committee. Can you hear me okay?
We hear you loud and clear. Thank you.
Thank you.
I don't know if you heard, you got a minute and a half, please.
Yes, absolutely, Mr. Chair. My name is April Grunov, and I have been a registered nurse for over 20 years, and I currently serve as the Chief Nursing Officer at Riverview Health in Crookston, Minnesota. I appreciate the opportunity to join virtually today in a snowstorm that we're experiencing up here in support of Minnesota joining the Nurse Licensure Compact. For the past 17 years, I have met directly with our newly hired nurses during their onboarding, first as an employee health nurse and now as a nurse leader. The consistent theme and frustration that I have heard from many of the nurses is the burdensome process of obtaining a Minnesota license for nurses that are already licensed in a compact state. The current process prevents nurses from starting work promptly, delaying their earnings, and limits timely access to care for our communities. My message has been the same: an apology for their experience, an offer of support in any way that I can, and a strong sense of optimism and advocacy that Minnesota advances this legislation for the profession of nursing. I speak on behalf of all of those nurses with hope that their future colleagues have a more seamless experience. Now is that time. Additionally, as Chair Schumacher mentioned, because Minnesota is not a licensure compact state, our hospital, which is located just 25 miles from the North Dakota border, currently covers the cost for our nurses to maintain dual licensure so we can provide telehealth and care coordination to patients residing in North Dakota. This creates unnecessary financial and administrative burden. From a finance and policy perspective, the compact reduces administrative burden for both the state and employers, improves workforce mobility, and enhances Minnesota's competitiveness in attracting nurses who are increasingly expecting multi-state practice flexibility. I respectfully urge the committee to advance this legislation and position Minnesota for a stronger, more resilient healthcare workforce. Thank you for your time.
Thank you, members. Is there any questions? Just to give you outline, we will go to vote at the 44 mark, so 2:44. It looks like Representative Doe, did you have a question? And then I have Representative Gilman, and I think that will be our only two members that can do questions.
Thank you, Mr.
Behrman, too? Okay.
Thank you, Mr. Chair, and Representative Schumacher. I actually have a question if Andrea Kmetz can come back up. But while she's coming up, Representative Schumacher, can you look at lines 4.22 to 4.28? There was some testimony in the bill that was talking about how our state board, our state licensure would be circumvented, and it appears to me that you've addressed that in this bill, line 4.22 to 4.28. Can you just speak to that quickly before I ask Ms. Kmetz a question?
Thank you, Mr. Chair, Representative Nadeau. The thing with compacts, this isn't my language. This is the compact language for that. And so while I'd like to take credit for something that seemed to be insightful for this, I cannot. This is the language that is required to become part of the compact word for word and on here. But it is, as you read it, in there. Thank you.
Thank you, Representative Schumacher. Mr. Chair, can I ask Annie to comment on this?
Please.
Thank you, Mr. Chair, but Ms. Clark-Vest should comment on this.
Pass.
Sorry.
Go ahead.
Mr. Chair and Representative, I believe this paragraph is talking about a nurse having to practice. This talks about the nurse's practice. This doesn't necessarily talk about the nurse's requirements for licensure. So it says the nurse has to comply with the state practice laws in the state where the client is located, where the patient is, not where the nurse received his or her initial license.
Representative Nadeau.
So just one follow-up then. So let's just say that Minnesota requires an extra 3 years to become a licensed nurse. And if an out-of-state license doesn't have that 3-year requirement, would they be able to practice in Minnesota with this paragraph?
My understanding is yes, they
Okay.
would be able to.
Okay.
Because this paragraph relates to the care they can provide,
Okay.
not the qualifications for licensure.
Thank you. Thank you, Mr. Chair. Ms. Kmetz, you mentioned in your testimony that having a compact would not, it would not help solve the problem. And in Minnesota, we do have a problem. We have a problem across the board. I recognize that 80% of the nurses are M&A nurses in our major hospitals, but they are a small portion of the overall nurses in the state. We have 150,000 nurses, and so how can this not help by opening up that opportunity like the administrator or the nurse at Ridgeview? How could this not help?
Go ahead.
So, thank you, Mr. Chair. How would this not help? So when I look at a compact, I've been a registered nurse for a long time. I currently work at as a nursing practice and education specialist at Minnesota Nurses Association. We are bound by our Nurse Practice Act to provide the best care to our patients that we are possibly able to do. And you are absolutely correct that there is a problem, right? There's a problem with nurses are not being listened to, that they're being held to standards that are unobtainable, that you can't take on 8 patients on a day shift and be able to take care of them the way that those patients deserve to be taken care of. So when you're talking about how nurses are replaceable by nurses from another state that do not have the same standards of care, do not go to the same education, do not have to sustain the same amount of educational background. When you bring them into, they're not going to know the difference. I also want to talk about the fact that when it comes down to the working conditions that nurses currently have, CEOs, CNOs, they put these nursing practice conditions in place. There's policies and procedures that they have to follow. We don't have the ability to say, no, we're not taking care of that patient, because that's not what we do. We take care of our patients. Any patient that's in front of us, we're going to take care of. But people are getting burnt out because we have a true passion for taking care of these patients, and we want the best for them. We want to do everything to the best of our power, but we're spread thin. We don't have the resources that we need. We don't have the support of the hospital systems. I left the bedside because I wanted to make a difference and help promote nursing practice and be able to stand up for our patients and be able to truly help them to the best of our abilities.
Okay, I need you to wrap up. Okay. Final comment, Representative.
And thank you. And I don't know if you answered my question, and I think that's why I brought up the practice question earlier, is that, you know, any nurse that comes from another state has to match the practice requirements that we have in the state. And so I think that's my point, is that having more opportunity to have more nurses practice under the requirements that we have in this state. My question was, and I don't want you to answer it, we're out of time, and but I will follow up with you after this, thank you, is that I just don't understand why not opening that up would, for more practicing nurses under our practice requirements that are in this statute, how that couldn't help our healthcare system. Thank you, Mr. Chair.
We're going to go to a vote.
Mr. Chair,
Representative.
I'd like to ask for a roll call.
Okay, roll call has been called. So,
Mr. Chair?
Representative
Mr. Chair, can you reiterate, please, what the path of this is before we take the vote?
Yes, I was going to do that, Representative Barnes. I was going to give Schumacher a final word. Representative Schumacher, any final words to this bill?
No, Mr. Chair, just to say that I believe Representative Liebling is right on the piece there was that little gnawing voice in the back of my head that they had to go somewhere else. So I would hope that the motion would be to send it as amended to the Judiciary Committee.
Yes, we're landing the airplane on that. Okay. So we are, the House File 1925 as amended would be recommended and referred to the Judicial Committee. So with that said, we're going to take a roll call.
Chair Becker?
Aye.
Chair Bierman?
No.
Vice Chair Nadeau?
Aye.
Vice Chair Rarer?
No.
Representative Bonner?
No.
Representative Carroll?
No.
Representative DeBelle?
Aye.
Representative Elkins?
No.
Representative Franson?
Yes.
Representative Gilman?
Aye.
Representative Hewitt?
No.
Representative Keeler?
No.
Representative Knutson?
Aye.
Representative Lee?
No.
Representative Liebling?
No.
Representative Mahamud?
No.
Representative Perryman?
Yes.
Representative Purcell?
Purcell, no.
Representative Rapinski?
Aye.
Representative Schumacher,
Schumacher, aye.
Representative Van Binsberg,
Aye.
Representative Zelenskar,
Zalesnikar, aye.
Okay, motion, the vote is 11-11 due to a tie. The motion does not prevail.